Hello, buddy. You're on the SOMAR channel. Enjoy watching. Doctors, tell me about your dumbest patient. I once had a child brought to me who had swallowed a rather large magnet. It was in his intestines, so we just had to wait for him to take a piss. The next day they bring him back to me again, and they say he ate another magnet. And it turns out the second magnet was magnetized to the first magnet through the stomach wall, causing an intestinal obstruction. We had to send him straight to the operating theater, where they surgically removed them. The patient comes in with abdominal pain and says, "I think the problem is in the gallbladder." I look at his medical records and see that he had his gallbladder removed 20 years ago, so that's impossible. I tell him that. The answer is, yeah, but I guess it's grown back or something. A patient comes to me with her mother. Mom asks me to fix her daughter's scrotum. I'm trying not to laugh. Fix your daughter's scrotum? To which she reacted like I was the idiot here and pointed to the back of her neck. I knew there was no point in correcting her, since she wouldn't listen to me anyway. Plus, I wanted her to keep going around telling other people that. I already posted this before, but the occasion is too good not to remember it again. A couple comes to see me. A 20-year-old girl and her fiancé. It's just been revealed that she's pregnant. Me, looking at her story, "Do you smoke?" She, "Yes, about a pack a day." Me, "You should definitely quit smoking." She, "Yeah? And my sister told me that if I quit now, the fetus will go into withdrawal and could die." Me, "What?" My dad is an orthopedic surgeon who often performs knee and hip surgeries. He has a favorite story that makes him laugh every time. One time they brought in a woman who was so clueless about how surgery works that she decided that to operate on her hip, they would have to amputate her leg first and then sew it back on.
I blame the Barbie dolls.
My work is closely related to eye surgery. Believe it or not, about 25% of patients think that we take their eyes out during surgery.
My mom works in a hospital and is constantly feeding me awesome stories from the x-ray technicians. Last week they had a patient, a grown man, who stuck a huge carrot up his arse. Dude came from some village, very conservative. He traveled for 3 hours, stopping because he couldn't sit for obvious reasons. If I ever decide to change careers, I'm going into radiology. I know a dude who went to the doctor afraid he had cancer because he scratched his eyebrow one day and a few hairs fell out.
Damn, it looks like I have cancer too.
That's doubly stupid because it's not cancer that makes your hair fall out, it's the cancer treatment.
I work in an ambulance. Called in for a stroke. The patient has a sagging face and speech impairment. She says she feels the same as she did when she had a stroke 10 years ago. She goes on to say that the symptoms appeared 4 days ago and that she had already realized she was having a stroke. I ask, "Why didn't you call us right away?" She says, "I was hoping it would go away on its own." 2 stories immediately came to mind. One from me, I'm a clinical pharmacologist, and the other from my colleagues at the trauma center. 1. The trauma center story. They bring a 16-year-old boy with an unrealistically swollen penis that has lost its natural color. It turned out that the boy had been stealing his mother's insulin syringes, taking blood from his hand and injecting it into his penis, hoping that the blood supply would help him increase the size of his penis. This eventually led to a powerful infection that left him hospitalized for a week. 2. A girl comes into our pharmacy and asks for birth control pills. I run it through the computer and see that I can't give her more because less than a fortnight ago, she had already taken a 28-day pack. When I asked what happened, she said she ran out. Turns out she'd been taking them with her boyfriend. They thought it was a pill for both of them, and that it was the only way to avoid pregnancy. I once had to explain to a 17-year-old girl and her mother that she was not allergic to alcohol, but had a regular hangover. Her complaint was that sometimes when she drank a lot of vodka, especially on an empty stomach, she would get nausea, blush, and vomit in the morning. She had no other symptoms of allergies. Wait, there are people who are allergic to alcohol? Yes, they do. Source, all you have to do to kill my mother-in-law is give her a few beers. Once a grandmother and mother brought their daughter-ish-granddaughter to a trauma center complaining of bleeding, except that this bleeding was not due to an injury or bruise. It was just that the girl had started having those days, and the mom and grandmother didn't really want to explain what it was, and that it was normal, even though they both knew exactly what was going on. On the plus side, it was a very quick visit to the trauma center. We once had a 24-year-old prisoner brought to us, who was in some rural prison. The dude was working by the side of the road, found a bottle in a ditch, and decided to drink the whole contents, hoping it was alcohol. I'll be honest, I would have thought there was whiskey in that bottle too. But no, There was some sort of substance containing sulfuric acid. The pH level was less than 2.5, so it corroded the litmus paper in a heartbeat. He ended up in intensive care with a hell of a lot of pain and bloody vomit. The gastroenterologist gave him a gastroscopy. It's a procedure where they insert a tube with a camera into you and look at your esophagus, stomach, and duodenum. The picture from the camera was just awful. You could literally see his stomach and esophageal mucosa being eaten away. It was decided to send him to another hospital, which found a surgeon who could fix such an inferno. The boy had to undergo many operations and stay in the hospital for some time. He was lucky he was still young and healthy. Not very smart, though. Otherwise, I don't know what would have happened. A few months later, he came back to us with some other problem. I don't know what happened there, but he lost weight from 68 kilograms to 41 kilograms, and I saw him being fed through a tube. A guy came to the outpatient clinic with a swollen left testicle and explained that his girlfriend had injected him with kaput oil with his consent to keep him in bed longer. It was extremely difficult for me, a female intern, to contain my emotions. When I introduced myself to the patient, I said that I would be his anesthesiologist, to which the patient replied that he didn't want me to be his doctor because anesthetists aren't doctors. Not long before that, there was another dude who asked me if you had to go to uni to be an anesthetist, and another asked if anesthetists need to know as much as pharmacists. A story on the subject from a friend of mine who is a gynecological oncologist. He had a patient with early uterine cancer. When he suggested surgery, the patient refused and decided to try alternative treatments, like coffee enemas, meditation, and other nonsense. She even went to the Dalai Lama with her problem, who advised her to go back to her doctor. I'm a dental student. One of our patients is a pathological liar. He tells us he went to med school. He tells us he was a dentist in the army, and the last time he told us he had a doctorate. His patient's always talking shit like, "Hey doc, should I turn my head distally or medially?" "No, I need you to turn your head to the right." "Hey doc, are these holes in my teeth? Is that because of anaerobic microbes?" "No, it's because you eat sweets and don't brush your teeth." A patient came to the trauma center with a cold and demanded that I prescribe antibiotics. I told her that they don't prescribe them for viral symptoms, and she was so insistent that I had to give her a little education on viruses, bacteria, antiviral drugs, and antibiotics. I hope it helped her pass her final exams. I didn't forget to mention she was a med student, did I? I went to the family to tell them the sad news that their relative was about to die because her tests were incompatible with life. pH 6.6, lactic acid 25. In response, her family asked me to put ice in her pants because that should definitely bring her to consciousness. No, I don't do that sort of thing. Then she died, and her family tried to wake her up for a while. In my line of work, I often have to deal with heroin addicts. They all have a belief that if you overdose, you should put ice in your pants and you will come right off. But I've never heard any clear explanation for this story. Oh my goodness, it's my time to shine. 1. A man brought his wife to the emergency room. She has a 7 centimeter by 7 centimeter ulcer on her leg, diabetic foot syndrome, from which yellow-green pus with some maggots is coming out. I quickly examine her and send her to surgery. My husband starts to argue that we need to check her kidneys first. "Doc, it's just a wound. Check her kidneys first? I read on the internet that diabetes can cause them to fail. Do something about it." I had to spend an hour explaining to him that his wife would rather die of sepsis than a failing kidney. 2. I'm examining a child with measles. His parents, ardent opponents of vaccination, are sitting next to him and yelling at me, "Why the hell does modern medicine still have no cure for measles?" I tried to explain that there is actually one preventative measure that they choose not to use. They, what is it? Me. Well, you could have been vaccinated. Them. Are you from the pharma lobby too? Yeah, whatever. I'm a pharma lobbyist who wants children to die. That's the end of it. You can watch our other videos. Thanks for watching and don't forget to subscribe. Bye-bye.